Welcome back. Okay, Marjorie, we've got so many questions for you from viewers right across the country. This one is from Emily from Montreal. Oh. She says, my mother's menopause started at age 44, but I'm in my early 50s and I still have regular periods. Is this normal?
So, yes.
Yeah.
Your mother's age at menopause is an important indicator of where you will be. That said, you also have genes from some other half, which is your paternal complement.
Yeah.
And so you may not necessarily behave exactly as your mother did. The perimenopausal transition is on average age 41 to 51. Okay. So some women will start to have menstrual irregularities earlier on, and some women have it later on. Some women have their menses into their 50s, even though the average age of menopause is 51. Now, it doesn't mean you're going to be making babies. Your eggs have hard hats at that stage. So it doesn't mean that you're going to be trying to get pregnant at that stage.
Right.
But it does mean that it's relatively normal. Now, if you have irregular bleeding and you're in your 50s, so it's very unusual, you should have that checked out because that can be due to something else. So don't just assume it's your period either, especially if it's leading into 55, 56.
Got it. Okay, really good. This is Sue from Toronto. My baby has lost weight since I brought him home. Is this normal?
Yeah, absolutely. So babies lose 10% of their birth weight and then they regain it.
Yeah.
So you expect that, and that's why you have the pediatrician appointments and they weigh the baby and they measure the baby and they do all these things just to make sure the baby is meeting the milestones from the time of birth. But if the baby continues to lose and does something so failure to thrive is something that we worry about if the baby continually loses and doesn't get into that gaining again. Okay. So it's important to be seeing your pediatrician or healthcare provider regularly so that they can do the weighing of the baby. But don't panic if there's a little bit of weight loss because that's normal.
There's definitely some fluctuation there. Chloe from Calgary writes, I'm worried that my sister may be going through postpartum depression, but when I broach this with her, she gets very defensive. Is there anything I can do to help?
So postpartum depression is tricky because you don't want people to get into that anhedonia or hopelessness feel, and you can't bring them back.
Yeah.
And ultimately, if people are in the postpartum period, generally they have appointments with the doctor for the baby that they try to adhere to even if they're feeling low.
Yeah.
So you can be their support person and go with them and gently speak at the time that there's a physician there and say, you know, I've noticed that you've been feeling low. Maybe you want to talk to the doctor about it. You have to take an opportunity where somebody else can intercede. So you drop, you let the ball go, and then somebody else takes over for you. Because it's important to bring these things to light. It's very common. We've talked about it before.
It's very common. So I'm sure as a doctor as well, you're on high alert for it.
Yeah, so I don't see people so much postpartum anymore, but that's one thing that we are on high alert for because we have to be mindful that it can get dangerous for the patient.
Just got to talk about it, which is
Absolutely.
hard. It's a hard first step.
Absolutely.
Really good answers. Thanks. Okay, so for this year's Scrubs in the City fundraising event for the Hospital for Sick Children, the Evergreen Brickworks is going to be transformed into All Things Tokyo, which sounds so cool. Proceeds from the June 4th event will help fund new MRI machines for the hospital. And after the show, we're going to draw for a pair of tickets to the gala. Sounds like a blast. If you want more information, cityline.ca. It's a great time. Stay with us. We've got more coming up on Family Day.